These are the drugs that can help homeopathy. First is arsenic alum. He's talking about
Second technique is cancers.
arsenic alum. Then
In
cantharides.
prostate cancers, it is very useful. There
Cantharides.
is a pain
Burning.
before and during after urination. That also one of the important symptoms in cancers.
That's true. Cantharides.
Third drug is ruta. Ruta
Ruta.
is very helpful drug in bone cancers, where there is a skeletal metastasis in there.
Metastasis.
It does all very
Breast
effective
cancer
in
और
bone
prostate
cancers.
cancer में generally bone में touch हो जाता है.
Fourth drug is bryonia.
Brand new.
Bryonia is a wonderful drug for lung cancers. It reduces the inflammation in every part of the body. So anti-inflammatory drug.
Okay.
So arsenic or bryonia
Bryonia.
is anti-inflammatory drugs.
Cantharides.
Second thing is magphos. That also was
Magphos, yeah,
very,
phosphorus.
really it is also wonderful drug
Where
for
there is
pain medicine.
bleeding.
And citrus lemon. Citrus lemon also
Citrus
very useful
lemon.
drug in cancers of the mouth. You can use this drug as a mouthwash,
Citrus.
like hydrosis. Even you can apply hydrosis also externally and internally also. That is a magic therapy in cancers. These 7 drugs are which are useful in our practice, even though I verified this in many of the cancer cases. So coming to the point, mostly I practice on the basis of pathology only, because of time management. So generally, typically I handle 60 to 70% per day. In weekdays, 90 to 100 patients. So it is not possible to manage these patients within 4 to 5 hours. That's why I adapted this pathological prescription for the first 2 weeks. So pathology plays very important role here. When the remedy causes a pathological symptom, that also causes the important rubric for selection of medicine. So, actually speaking, pathology, when you study the materia medica, read the toxicological effects of the medicine, then you will find the drug effect of the drug also. So, when we are coming to the malignancies, most of the drugs, what we use in our practice, the topmost drug is hydrosis.
Hydrosis cannot exist.
Hydrosis is a effect, it's effectively on the mucous membranes of the body, especially mouth, throat, rectum, cervix, anal canal. Okay. So here, characteristic indication of hydrosis is abnormal quantity of secretions are increased in this drug, such as stomatitis, ulcerations of the buccal mucosa. Second drug, arsenic, very wonderful drug in cancer. Mostly this hydrosis is for cancers of mouth and rectum, but the arsenic is mostly useful in leukemia cases, in other cancers also, where the mucous membranes are found, especially GIT system. GIT, throat, duodenum. It also relieves the inflammation in every part of the body. So when you study the toxicology effects of this arsenic also, it is a double-acting remedy. Profoundly, it reaches the cerebrospinal system and ganglion cells. So arsenic, not most abused drug in my practice. 90% of cases I prescribe arsenic as first line. Not only in cancer cases, allergy cases, HIV cases, diarrhea cases. So most abused drug in my practice. Arsenic or anti-mass. Third drug is Mexol. Natron is a very useful drug in leukemia cases. So here also characteristic indication of this drug is disintegration, deterioration of the tissues is a marked symptom of natron. Disintegration and deterioration of the tissues is a marked symptom. It is associated with acrid lacrimation, acrid discharges, and emaciation and weight loss. So most of the symptoms are visible in cancer cases, like leukemia cases also. Third is Mexol. So Mexol is a wonderful drug for many cancer issues. Here also there is characteristic indicators.
What is it?
Engagement and induration of the cancer. There is a tendency to ulceration, malignant ulceration, ulceration of the embryo tissue. It leads to universal decay of the organic structures. This is the most symptom of pathological symptom of Mexol. Ulceration of the tissue leads to universal decay of the organic structures. So this is also very common symptom in cancer cases. So on the basis of pathological symptoms, these drugs are very useful in our practice. Apart from these 6 drugs also, phosphorus, protease, and bryonia are also very useful drugs. Then coming to the point, because drug selection means you depend on your intelligence, depend on your knowledge, not that you drugs, not that you because most of the drugs based on the intuition. For example, when patient comes to my chamber, generally they go to our Durga Doctor Lashmi. She takes case 20 minutes. After that, they come to my chamber. Generally, I spend 5 minutes to my patient. So, after coming to my chamber, often I get one impulse, this drug suits to me. After taking case 5 minutes, again one more impulse comes to my mind. No, this drug suits to me. So, mostly my drugs based on second impulse, just in the span of 20 to 30 seconds. 90% of cases I based on my intuition. So successfully I treated, still same demand, same popularity is going on in my practice. So depend on your intuition. Intuition always comes through your positive bias and knowledge and your clinical observation. So that is the main crux of cancer issues. Now I would like to present one case of carcinoma of stomach. The optimist that we are already know about what is carcinoma. So that I can case details. Of weight loss, heaviness of abdomen, lack of appetite, loose motions, constipation, dark stools, nausea, and burning urination. Initiation finding, CT abdomen, evidence of hypotenuse non-enhanced pressures on 14 into 12.2 mm. Hydronephrosis, secondary to uterus by motor muscles, chronic cystitis, multiple discrete abdominal injuries. CA 125, 28.5, WBC 25 no HP. Not suggested chemotherapy and radiation, metastasis, 75% of organic failure, final stage 3 to 6 months lifespan. Then they came to my clinic. Homeopathy management, first report 25,200 WBC, other findings also there. So I started asking on the basis of symptoms only, on pathological symptoms only. Then I given high class test mother teachers also, daily, along with asking. So first video, after now after 15 months still she is leading good life without any complaints. She is attending her guidance, everything will be clear also. Now she is really better. That is the case of carcinoma of stomach, almost 18 months from